Welcome back to Inspire Great Health, your local trusted healthcare podcast. Today we have Dr. Cecily Lykes from the Orthopedic Surgical Specialist Group. How are you today?
I'm doing well. How are you doing?
I'm doing fantastic.
Good.
So just go ahead and tell me about yourself, where you went to school, just a little bit about your training, and what inspired you to become a healthcare provider.
Sure. So I am from actually the Colorado Springs area. I did my undergrad, grad school, and then medical school at Rocky Vista University up in Denver. So my medical training, or pre-med training, was in Colorado. And then I was part of the Health Professions Scholarship Program through the U.S. Army. And after I finished medical school, went to Tacoma, Washington, where I did my general surgery internship. After internship, I was restationed by the Army as a flight surgeon and got restationed at Fort Carson in Colorado Springs, where I served with the 4-4 Combat Aviation Brigade. We also included a deployment to Afghanistan during that, and after I was done with the service, came out and finished my residency at University of South Carolina, Prisma Health in Columbia, South Carolina, and then did fellowship in foregut, complex GI, and general surgery at Richardson Methodist in Richardson, Texas, with Dr. Rohan Jayaraja. And then after I finished fellowship training, went back to South Carolina and practiced in Columbia for the immediate past 3 years prior to coming to Cheyenne.
Wonderful. So it just sounds like you've just been in medicine for a long time.
It's been a long time.
Yes, no, that's
it's been
great.
A long time.
That's great.
It's been a long time. And it's been interesting because I've had a mix of civilian medicine and I've had a mix of military medicine. So I think that those experiences in both of those realms kind of add to what I can offer patients today.
And what inspired that journey? Was it just something that you fell into when you joined the military, or was it something that you've been passionate about?
It's been a passion ever since. I mean, honestly, my mom would tell stories about me as a young child dissecting fruit, and so I think that ever since I was young, I was driven towards science and medicine, and then with being interested, I'm very service oriented. And I think that medicine combines the science with the service-oriented nature and kind of melds beautifully to give me a profession where I can help people in a scientific way.
So you're from Colorado Springs originally. What drew you to Cheyenne?
Well, when I was looking for a different opportunity for work, my husband, who is a South Carolina native, and I looked in kind of the East Coast, South Carolina area, but then also looked in the Colorado and the mountain area. And this opportunity at Cheyenne Regional Medical Center came up, and after meeting everyone here, it was kind of a no-brainer. I mean, everyone is just so wonderful. My partners are fantastic. The entire surgery group is just, everyone is just so friendly and welcoming, and it really felt like we could find a home here. So we said yes as soon as the offer was extended.
Well, we're glad you found a home here. We're happy to have you.
Thank you.
So what types of services do you provide?
I provide, my primary specialty is foregut, complex GI, and general surgery. So foregut are diseases of the stomach like paraesophageal hernias, hiatal hernias, people who have issues with reflux. I do anti-reflux procedures. Dysmotility issues of the esophagus. There are some surgeries that we can do to help with that. So the foregut is essentially the esophagus and stomach, and sometimes the first portion of the small intestine. And then the complex gastrointestinal, those are things like abdominal wall hernias, intra-abdominal complex issues like people who have had multiple surgeries have a lot of adhesions within the abdomen or issues because of that. I deal with abdominal wall fistulas. And then the general surgery, general surgery, as the name implies, is a lot of things. So, I can start from the neck and talk all the way through the body as far as what I do, but, thyroid, parathyroid, I do benign and malignant breast disease in men and women. as far as inside gallbladder issues, all of the foregut issues, colorectal, anorectal, skin and soft tissue, and then the emergency general surgery or acute care surgery. So when people come in with, appendicitis or a bowel obstruction or diverticulitis, we manage all of those things as well. And then here at Cheyenne Regional, I'm also part of the trauma team, so I'll be responding to the traumas that we receive here too.
So you're kind of all over the
All
place.
over the place.
Wear a lot of different hats.
Honestly, that is the characteristic of a general surgeon.
Mm-hmm.
It's just that with all of these different specialties that have kind of come around and fellowships that have developed, the general surgeon is now kind of pieced out into things like bariatrics, breast, foregut, colorectal, and so it kind of pieces apart what the general surgeon used to be. So I like that this is a place where I'll be able to kind of bridge all those parts back together.
What is your care philosophy? How do you approach a patient when you begin treating them?
It's simple and it may sound cliche, but I really truly treat every patient as if they are a family member or a close friend. I offer the same recommendations, suggestions, and care that I would for my husband, my sister, my mother-in-law, family extending, and my friends. And I think that if I can approach it that way, I can also instill confidence with the patient that I'm going to do everything I can to take care of them in the best way possible. And then beyond that, I find a lot of importance in continuing education, keeping current with current surgical therapies and the way things are changing, new emerging technologies. And because I attend conferences and keep up with that, I feel like I'm able to offer kind of the newest and most up-to-date therapies and treatments for patients.
Now, tying on to that patient care philosophy, some patients may feel nervous when they go in for a surgery. How do you ease that tension?
I like to establish a relationship with my patients if I can, even if it's a brief interaction, to the point where they understand that I'm going to do everything possible. I like to take care of them. I like to explain the before, the during, and the after. So it takes away some of the unknown, because I feel like a lot of the nerves, especially if people have never had surgery, is the fear of the unknown. And so if we can demystify surgery to a point where people feel comfortable, I think it not only puts them at ease, but then they understand that they are being placed in the hands of somebody who's competent and capable and they can trust. And those two things, I think, kind of help mitigate any fears.
How can patients get in touch with you? Do they need a referral to come see you, or can they just make an appointment with OSS?
They should be able to do either. They can either get a referral from their primary care provider or another specialist that they're seeing that thinks that they may need a general surgeon or a foregut surgeon or any of the other things that I offer, or they can call and make an appointment directly with me through the clinic.
Okay. Is there anything else you'd like your viewers or your patients to know about you?
Well, my husband and I are really happy to be in Cheyenne. We're excited about the new adventures and really looking forward to getting to know the community and becoming an integral part of the community. And I look forward to seeing everyone that needs to come and see me as soon as possible.
Thank you so much for joining me today, Dr. Lykes.
Thank you very much. I appreciate it.
Of course. And if you need any help with your tummy issues, be sure to see Dr. Lykes. And thank you for tuning in. We hope to see you next time.